back, and in this video we continue our discussion about the muscles of human body. And today we have a set of muscles which are very important and quite known to each one of us. That is the muscles of anterior abdominal wall. You might have heard a lot about these muscles. You might have heard, seen different pictures of these muscles in films, etc. And with bodybuilders having 6-pack, 7-pack, 8-packs, etc. You might have heard a lot about different strategies and strengthening exercise to build a proper and well-set abs. We are going to discuss each one of that muscles in the most simplified manner. Yes, when we discuss about the muscles of anterior abdominal wall, I need you to remember two important things. There are two sets of muscles in anterior abdominal wall. There are two sets of muscles in anterior abdominal wall, and they are flat muscle group, the flat muscle group, and vertical muscle group. If you remember this key differentiation between two set of muscle group, in fact, with this simple differentiation, you can study or you can remember and find out and memorize the origin insertion of this muscle. One is a flat muscle group. What do you mean by flat muscle groups? The muscles will be running relatively in a flat orientation. The second one is a vertical muscle group which would be running either in this direction or in this direction. So you have two sets of muscles in anterior abdominal wall which include a flat set of muscles and a vertical set of muscles. Let us just go through the names of that flat set of muscles. They are known as the external oblique muscle, the internal oblique muscle, the transverse abdominis muscle. So simple to remember the names: external oblique muscle, internal oblique muscle, and transverse abdominal muscles. So when you remember or when you try to recollect the name, you see that we have the external oblique. Okay, that is the first key point. Second one is the internal oblique itself, okay, and third one is the transverse abdominis muscle. Transverse abdominis muscle. So if you look these three pair of muscles, what can you find out from them? The one is the external oblique muscle. So this is the most superficial muscle in the anterior abdominal wall. So the most superficial muscle in the anterior abdominal wall is your external oblique muscle. Immediately below the skin, immediately below the superficial fascia, you have the external oblique muscle. So this can be a viva question. Which is the most superficial muscle in the anterior abdominal? It's not your rectus abdominis, it's the deepest muscle. So remember, it is your external oblique muscle, right? Immediately below the external oblique muscle, we have the internal oblique muscle. We have the internal oblique muscle, and immediately below that you have the transverse abdominis muscle. What can you figure out from this name? The transverse. Transverse means that the fibers runs in transverse direction. What can you figure out from this name? Oblique. Oblique means the fibers runs in some angle. Clear? So this simple sort of differentiation between the names can help you remember the orientation of these fibers. So let us look into each one of these fibers in detail. The first one is the external oblique muscle. Remember, that's the most superficial muscle in the anterior abdominal wall. And I need you to remember one single word, that is the orientation of the external oblique muscle is in inframedial direction. Okay, the orientation of the external oblique muscle is in inframedial direction. Don't forget this key important point. To understand the anterior abdominal wall, you just need a diagram like this. You don't want chart, you don't want to write in 3 or 4 pages to study the origin, insertion, action, nerve supply, etc. You just need a diagram like this. So let us see how it can become so easy for us. So this is the inframedial is its orientation. So look at here, which are the structures? Superiorly you have the ribs, inferiorly you have the iliac crest, pubic symphysis, pubis, etc. It's all quite known to us, and in the both sides you have the thoracolumbar fascia. We have a fascia here known as the thoracolumbar fascia or lembodorsal fascia, and that's seen relatively in the lateral sides. Not exactly like this, it's not bringing or it's not making up any wall or a rigid structure like that, but it's related attached to the flat muscles. Okay, so you can consider or assume this to be in that direction for your convenience or for our convenience. So let's look at what is the orientation of external oblique muscle. The key point here is the orientation is in inframedial direction and they are oblique fibers. So if it is inframedial, they should start from superior part, right? And superior part, what you have? You have ribs. So these muscles are originating from the ribs, lower 8 ribs. How many ribs? Lower 8 ribs. So these muscles will be arising from outer surface of lower 8 ribs. Okay, outer surface of lower 8 ribs. So which are the lower 8 ribs? 5 to, how many ribs do we have? How many ribs we have? We have 12 pairs of rib. It would become 5 to 12th rib. So this muscle will be arising from the 5th rib to the 12th rib from the outer surface. So that's clear. If you remember this direction, you can figure it out. They will be arising from outer ribs surface of lower 8 ribs. No need to remember the outer surface. Just remember at least you have to remember the the lower 8 ribs. Lower 8 ribs. If you remember lower 8 ribs, you can write down one more differentiation, that is 5th to 12th rib. That is the 5th to 12th rib. So that is how these muscles are arising. And one more differentiation is that all of these muscles will be attached to a structure which passes through the center of the body from the severe process to the pubic symphysis. That is known as the linea alba. That is known as the linea alba. That is a white fibrous sheath. Okay, that is a white fibrous sheath where these muscles are trying to, or muscles, the aponeurosis of these muscles comes to join together. So this is the linea alba. That's a structure. We can see the white patch in our abdominal wall. If you closely look into that, you can see that in center raphe, it is a center line in the abdominal wall. Okay, so this is the orientation. This is the starting. The ribs arises from the outer surface of lower 8 ribs, and they run in this direction like this, and almost all these muscles at the center region forms a large aponeurosis like this, a large aponeurosis. So in central part you won't see this muscle but only the aponeurosis, and this aponeurosis attach it to the linea alba. So you can say that these muscles are inserted originating from the lower 8 ribs and inserted into the linea alba. Not just linea alba, this is the inframedial direction. So one structure in which it is attached is the linea alba. The second structure is your iliac crest. The second structure is your iliac crest, because that is seen in the lower part, that is in the iliac crest. Where in the iliac crest? Outer lip of the iliac crest. You know that iliac crest contains, if for example, if this is how iliac crest is there, an outer lip is there, a medial lip is there, and the centermost region, that is the crest of the iliac bone is there. Okay, so this will be attached to the outer lip of the iliac crest. So clear? So this is so simple. If you know this orientation and if you try to recollect what are the landmarks in this region, it is so easy. It arises from the lower 8 ribs and inserted in the outer lip of iliac crest and the linea alba. That is your which muscle? The external oblique muscle. Now forgetting about the external oblique muscle, let's move on to the internal oblique muscle. So what did we, what was the key point here? This is the inframedial. Here the key point would be supromedial. Here the key point is supromedial. So the orientation of this muscle fibers is supromedial. Is it a confusing thing? Inframedial, supromedial. Remember, always it is medial, because these muscles are arising from lateral to medial side. You just have to write infra and supra with that. In external you give infra, then internal you can give the supra. It's always in the medial direction. Clear? And now let me just ask you, where is the origin of this muscle? Where did our internal oblique muscle insert, external oblique muscle insert? It inserted into the outer lip, right? It inserted into the outer lip, where in the iliac crest. Now look at this orientation. It should arise from the inferior supromedial direction. Okay, so it should arise from the lower structure and pass to the upper structure. It should arise from the lower structure and it should pass through the upper structure. So what is the lowermost structure here? That is your iliac crest. That is your iliac crest. So this muscle will be arising from the iliac crest itself, where here you see that outer lip we have the external oblique, medial lip we have the transverse abdominis. So it will be arising in between the internal and the external oblique and the transverse abdominis. Even if you don't remember that, just remember it arises from the iliac crest. So this set of muscle fibers arises from the iliac crest. They travel in the supromedial direction like this. They arises from the iliac crest. They travel in the supromedial direction like this. Okay, and they get inserted into the where can you guess? They will insert into the linea alba. Definitely all this set of muscles are inserting into the linea alba. They get inserted into the linea alba and the ribs. How many ribs? Lower 3 to 4 ribs. Lower 3 to 4 ribs in the inferior border of lower 3 to 4 ribs. See, this one was arising from ribs to down. This one was arising from down to ribs. So that's just the vice versa. So even if you remember the orientation of external oblique, you can definitely write down the orientation of internal oblique. So once again, let me tell you, the internal oblique arises from where the external oblique ends. Okay, internal oblique arises from where the external oblique ends. External oblique ends at the iliac crest. So it's arising from the iliac crest, more specifically between the origin of external oblique and transverse abdominis, and inserts into the lower 3 to 4 ribs and the linea alba. Not just that, I need you to remember few more points. Here you have the structure known as the inguinal ligament, and this muscle will be arising from the inguinal ligament also. This muscle will be arising from the inguinal ligament also. And remember, if there are some fibers which is arising from the internal oblique from this direction, all those fibers cannot insert into the linea alba. So some of those fibers will be arising in this structure, that is the pectineal line, pubis and pubic crest. That is the pubis and the pubic crest. Is it confusing? If it is confusing, just forget about that. Just remember this muscle arises from the inguinal ligament. So you can see that some of the structures will be arising from the inguinal ligament. All of them are going in the medial direction. So here it cannot go to any other structure. So it will be arising from inserted into the medial structure in that area. That is the pubis and pubic crest. That is a pubis and pubic crest. If you can, you just remember that. Otherwise, forget about that. So the internal oblique muscle arises from the iliac crest between the origin of external oblique and transverse abdominis muscle, and they runs upward in the supromedial direction. They insert into the linea alba and the lower 6 ribs. The internal oblique also has origin from the external, the inguinal ligament, lower lateral part of the inguinal ligament. And then we have the transverse abdominis muscle, which is so simple because the orientation of the fibers is in transverse direction. The orientation of the fibers is in transverse direction. Which is the transverse direction? This is the transverse direction. So this is the transverse direction, right? So this muscle will be arising from, this is not having any oblique orientation. So you cannot say inframedially or supromedially. You can write down that it is running in an horizontal direction. So what are the structures over here? You can see that I told you earlier, we have the thoracolumbar fascia. So it will be arising from the thoracolumbar fascia, and then the iliac crest over here. I told you from the medial lip of the iliac crest over here, medial lip of the iliac crest. So this muscle is having its orientation from this one like this, medial lip of the iliac crest. Then there is the inguinal ligament. From the inguinal ligament, then the thoracolumbar fascia. This muscle is having its origination like this. So, and also from lower 6 ribs. Lower 6 means 6 to 12 ribs, inferior border or inner border of lower 6 ribs. So this will be the orientation of this muscle fiber, and all of them are inserted into the linea alba, and all of them are inserted into the linea alba. That makes it is much more easy. So all of these are inserted into the linea alba. Am I right? Yes. And also into the pubic crest and the pectineal line, which we have added with the internal oblique muscle. So if both of these muscles are having insertion origin from the pubic crest and the pectineal line. If internal oblique was originating from this direction, the external oblique, the transverse abdominis inserts into the pubic crest and the pectineal line. Even if you forget that, there's no problem. You just have to remember they are inserted in the linea alba. So what is the orientation of transverse abdominis muscle? They arises from the thoracolumbar fascia, runs in the transverse direction. They arises from the iliac crest, which lip? Medial lip. They arise from the inguinal ligament. They arise from the lower six ribs. So an entire origin from this complete area and inserts into the linea alba, pectineal line and the pubic crest. Pectineal line and the pubic crest. That's all about the the transverse abdominis muscle. So the three flat muscles of this region: the external oblique, the internal oblique, the transverse abdominis. External oblique arises from upper pair of lower pair of 8 ribs. Okay, runs in this direction like this, inframedial direction, and inserted in the linea alba. The internal oblique arises from the top lower part, from the iliac crest, where external oblique, and comes upwards like this in the supramedial direction to insert into the linea alba and the lower 6 ribs, so 3 to 4 ribs, right? Yes. And then you have the transverse abdominis, which is running in the transverse direction from the thoracolumbar fascia and the iliac crest, inguinal ligament, lower 6 ribs. All of them are involved in that and inserted in the linea alba, and in the lower part they are inserted in the pubis and pubic pectineal line. So remember, internal oblique and the transverse abdominis arises from the thoracolumbar fascia. When I was discussing about the internal oblique, I did not mention about the thoracolumbar fascia. In fact, internal oblique is also having some origin from the thoracolumbar fascia. You can add on to that. And now moving on to the rectus abdominis muscle, which is known as the 6th. Now we move on to the rectus abdominis. Of course, the muscle abbreviated to be a 6-pack or 7-pack or 8-pack muscle. Yes, let's see how this muscle is arranged. You know that this is the most centralmost muscle in that region, and it is one of the most deepest muscle of the anterior abdominal wall also. Now, you should remember the rectus abdominis, and the other pair of muscles are the vertical muscles. I told you the 3 names of oblique muscles, flat muscles. Now let us see which are the vertical muscle. One is your rectus abdominis muscle, and second one is your pyriamidalis muscle. Pyriamidalis muscle. Okay, second one is your pyriamidalis muscle. This muscle many of us may not have heard about, because this is mostly absent in some of individuals. Okay, so this is a rectus abdominis and the pyriamidalis. Let's see what is the orientation of the rectus abdominis muscle. The rectus abdominis muscle is vertically oriented. So this should be its orientation. Either it should come from top to down or down to bottom. So it is coming from a lower part to the upper part. So lower part, what you have? You have the pubic crest. Okay, what is there? You have the pubic crest is there. You have the pubic symphysis is there, and also there is a tubercle in the pubic crest, that is the pubic tubercle. So what is its origin? 3 pubic, only pubic you have to remember. One is the pubic crest, one is the pubic symphysis, and one is the pubic tubercle. You can remember it like a CST or TSC, any abbreviation which you are convenient. So it's arising from pubic crest, pubic tubercle, and pubic symphysis, and they run in this direction. They run in this direction. And definitely with this direction itself, you can tell me what is its own insertion. What is its insertion? Not to the linea alba. It is inserted into the Simplified process. It's inserted in the Simplified process, and ribs 5 to 7. And ribs 5 to 7. Why only 5 to 7? Because 8 is attached to 8th one, 9th one, 10th one are known as which rib? False ribs, and 11 and 12 are known as floating ribs, though they are not directly attached to the sternum. So it will be attached only to the 5, 6 and 7. So 5, 6 and 7 ribs. So it is attached to the 5, 6 and 7 ribs. So it is arising from the pubic crest, pubic tubercle, and pubic symphysis, and attached to the 5, 6 and 7 ribs, and your important structure, that is your Simplified process of the sternum. Clear? That's all about the rectus abdominis muscle. But you might have heard and you have seen that there are some six-pack like appearance for this muscle. That is because there are some 3 to 4 transverse intersections in this muscle, and that gives that appearance in well-developed muscle, well-trained muscle. It is because of some tendinous insertion. Some tendons are intersected each other. That is why we have that appearance. Okay, we have that appearance because all of us have that, but it is more prominent in a developed abdominal muscle. Someone who have trained a lot in them, that is more prominent. So that are some tendinous intersections of the muscle. So these are two paired muscle, or this is a paired muscle separated by linea alba in the center. So remember the which muscle? That is your rectus abdominis, runs from lower to the upper part, arises from pubic crest, pubic tubercle, pubic symphysis, inserted into the Simplified process, 5 to 7 reps. Remember, it's only 5 to 7 reps. And the last muscle, the pyriamidalis muscle, arising from the pubic symphysis, and front of the pubis. If you want to know about that muscle, it is a very small muscle, only a very small muscle in this direction, very small muscle, that is from pubic symphysis and pubic in front of the pubic bone and insert into the linea alba. Most people, many of us, this muscle is absent. That is why we don't study a great deal of that muscle known as the pyriamidalis muscle. But remember, they are two pairs of vertical muscle. One is the pyriamidalis and one is the rectus abdominis muscle. Clear? So that's all about this set of abdominal muscles. And now let us remember what are the nerve supply of this muscle. It's so simple. They are supplied by anterior abdominal wall muscles now. So they are supplied by anterior, not the posterior, okay, anterior rami of thoracic spinal nerves. They are all seen attached to the ribs. So thoracic spinal nerves. Anterior rami of thoracic spinal nerves, T7 to T12. Anterior rami of lower 6 thoracic nerve. That is the nerve supply of internal oblique, external oblique, rectus abdominis, transverse abdominis. Clear? Only in internal and transverse abdominis, where I have told you there is an origin from the thoracolumbar fascia, you have to add L1 also, lumbar 1 spinal nerve also. Otherwise, you have to just remember T7 to T12. Can I repeat it again? So all of these muscles are arising from, you don't have to confuse about posterior rami or anterior rami, because this is anterior abdominal wall muscle. Anterior rami of not thoracic or lumbar, only thoracic, because all are attached to the ribs. Okay, all are related to the ribs. Thoracic spinal nerves, T7 to T12, or lower thoracic nerves. Just remember lower 6. Thoracic should end with 12 vertebra, so T7 to T12, and just in internal oblique and transverse abdominis at the L1. Clear? So that is the nerve supply of external oblique, internal oblique, transverse abdominis, rectus abdominis. Whereas in case of your pyriamidalis, it is the anterior rami of T12, etc. The lowest spinal nerve, it is anterior rami of T12, etc. It's anterior rami of T12, etc. That is the nerve supply, which is again so simplified and easy to remember. Now, what is the function of this muscle? What is the function of this muscle? All of this muscle have a one single function except the pyriamidalis. Leave that peculiar muscle, okay, because it's absent in some of individuals. So forget about that. All other muscles have a function on us. It compresses the abdominal wall. It compresses the abdominal wall, because you remember, you might have studied in thorax, you have studied in the functioning of the rib cage and the ventilation, the role played by this muscle. They help in developing the intra-abdominal pressure, they help in the descending of the abdominal, diaphragm, ascent of the diaphragm, etc. So all of these structures help in compressing the abdominal wall. Abdominal contents. Now, external oblique. You have in two sides external oblique, right? So what happens if that muscle contract? Two sides contract, it flexes the trunk. What happens if two sides internal oblique contract? It flexes the trunk. Clear? What happens if rectus abdominis contract? It flexes the trunk. So three of this muscle, which are the internal oblique, external oblique, rectus abdominis, flexes the trunk. What about the transverse abdominis? Because it's oriented in transverse direction, so it cannot flex the trunk, because the fiber direction is this one. So that has only one function of abdominal content. And finally, the rectus abdominis muscle, if it contract, it can go for the flexion of the trunk. And also your Pyriamidalis muscle, which is a very small muscle, has only function of providing the tension on the linea alba or maintaining the tension in the linea alba. So what are the function of all these muscles? Except the pyriamidalis, compress the abdominal muscle, external oblique, internal oblique, rectus abdominis flexes the trunk, and the transverse abdominis compress the abdominal organ alone. Pyriamidalis maintains the tension in the linea alba. Now, what happens if your right side external oblique contract? This happens, flexion to the right side. If external oblique in the right side contract, same flexion to the right side, left side. Internal oblique in the right side contract, the same thing. So internal oblique and external oblique muscle help in a lateral bending of the trunk to the respective direction if one of that fiber is active. So if right side internal oblique is active, it flexes it to the right side. If left side is active, it flexes to the left side. That's only possible for the internal and external oblique. So it was a vast discussion, I know, but it is relatively easy to understand. If you have any confusion, watch the video again and you will find it very easy to remember. These muscles are very important throughout your rehabilitation career because core strengthening is a very important aspect of rehabilitation as well as of proper fitness of an individual. So you need to remember these muscles. So remember these muscles of the anterior abdominal wall and master that one. We'll see you in the next video. Until then, stay tuned, and if you like the video, don't forget to click the like button and kindly subscribe to our channel and share the video with your friends so that we can help a lot number of students.